Well, there's a new warning this morning for people who have had COVID-19. A new study coming out of the University of Oxford, the largest of its kind, suggesting that 2 years after infection, there is still an elevated risk of brain fog, dementia, and other neurological conditions. Abby Kugadassan is on the story for us in London. Good morning, Abby. Let's talk about what's in this report.
John, the University of Oxford study has compared two groups. One group of more than 1 million people who had COVID about 2 years ago, and another group which includes people with different respiratory infections. And this was to better understand the long-lasting damage caused by the coronavirus. They looked at 14 different disorders and how likely these groups were to be at risk. And the study found that those who had survived COVID had about a 10 to 15% higher chance of some of these long-term conditions. Adults under the age of 64 were more likely to experience brain fog. Seniors, people over the age of 65, had a higher chance of dementia. And children had a higher risk of developing epilepsy, though Paul Harrison, the lead researcher on this study, stresses that it remains extremely rare. It was 260 kids out of 10,000 who were at higher risk, so that's about 1 in 38 cases. I also asked Professor Harrison if the COVID variant played any role in his findings.
Omicron is a much less severe acute illness, so many fewer patients died or needed hospitalization with Omicron than they had with Delta. However, if you looked at people afterwards, the risks of the things we were measuring in this paper were really the same, whether you'd had Omicron or Delta. So that suggests to us that given how common Omicron has become in the population, the things we measured in this paper aren't going to go away just because Omicron itself is a less nasty acute infection.
He also pointed out that the stress of the pandemic was felt by both groups, so that's not likely to have impacted these results, John.
Abby, we know that vaccinations can have an effect on how sick you become with COVID. Any impact in terms of what Oxford University is looking at?
Yeah, these groups were in the United States, and Professor Harrison says there was an unknown number of unvaccinated people in both groups. And as you mentioned, the science makes it very clear that vaccinations matter when it comes to reducing the severity of the infection. And Professor Harrison absolutely agrees with that, but says it doesn't appear to make a major difference when it comes to these post-COVID symptoms. Let's have a listen.
We found that if you'd been vaccinated and then you got COVID infection, after that infection, it didn't make very much difference to your risks of getting these kinds of outcomes. So although the vaccinations were very effective at stopping you getting COVID in the first place, if you were unlucky enough to get a breakthrough infection, it didn't really affect the things we're measuring in this paper. So we don't think that vaccination is a major confounder to these results, but it mustn't be ignored altogether for sure.
The study didn't look at the severity of these conditions or how long they lasted. The researchers do want to better understand why these symptoms are occurring, because that's the way to figure out treatments to either prevent or reverse the conditions. It's the largest study of its kind, but they acknowledge that more research is needed given that COVID is still a relatively new disease.
Abby, thanks for this. Abby Kugadassan in our London bureau.